The New Blue Party, and myself included, we are not anti-vaxxers. That message is being portrayed, but that is not the case. There are many, many of us who are vaccinated, myself included. And the issue is that regardless of your personal choice, you should not be discriminated against.
Hello, OneSunnyDay.com podcast. Today, my guest is Allison McKenzie. She is running for the Burlington seat under the New Blue platform. Hello, Allison, and welcome to the program.
Hi, Greg. Thanks for having me.
And people who want additional information can go to newblueontario.com, and you can reach Allison Burlington at newblueontario.com. So I always ask Allison, what got you into this mess?
Good question. So I have always had an interest. I think it sort of ran in the background for a number of years. My background is nursing. I've been a nurse working the front lines for over 25 years. Well, close to 25, my apologies. And I love serving the public and just being able to advocate for people and amplify their voices when they're unable to. So that is where the initial interest came from. And then in 2015, I enrolled at Wilfrid Laurier University to work towards a double degree in political science and global studies. So when this opportunity came up, I decided to apply for the candidacy of Burlington, and I interviewed and was accepted to be the candidate for the New Blue Party, which I was very excited about. There were several reasons that I started looking into options for the upcoming election, not necessarily immediately as a candidate, but more what the options were going to be as far as a selection or for parties. And I came across the New Blue Party, and their values, their mission statement, and the principles that the party was founded on aligned with my views, and I thought that this was an opportunity to take that role of advocacy and my passion for transparency and accountability to another level and be a voice for my community.
Excellent. So what were the main values that you saw there in the New Blue Party? And maybe you can explain to people what the New Blue Party is and why there was the general onus to create a new party in the first place.
So just a little bit of background about how the party became. So Belinda Carr-Halios is the current MPP sitting in the riding of Cambridge. She wasn't elected as a New Blue Party member. She was elected as a Conservative member in that riding. So back in, I believe it was September, October 2020, when the Ford government proposed Bill 195, which was labeled or titled the Reopening of Ontario Act. Belinda reads every bill that crosses her desk before she votes on it. So she read the bill in its entirety and thought to herself, this is not a bill that is promoting or in any way establishing the reopening of Ontario as we were in the middle of the COVID-19 pandemic. So she read it and she voted against the bill. When she did so, I don't know how quickly or how soon after, but the Speaker of the House removed her from the legislature, and she was removed from the PC caucus. So she maintained her riding, in Cambridge, and then her and her husband, who's Jim Carahalios, he's the leader of the New Blue Party, no stranger to politics. I believe it was the 2016 federal PC leadership that he was participating in. And together they decided, you know what, enough is enough. These establishment parties have blurred the lines. There's no more left, there's no more right. Like, everybody's blurred together. So they decided, we're going to start the New Blue Party to give Ontarians a true conservative option for the upcoming election. So the party was established in November 2020, and since then has grown to be a full slate of candidates, 124 candidates in all 124 electoral ridings across Ontario. So that's a little bit about the party. So the principles of the party are basically, the principles of the party are good government, a government that acts with integrity, it is transparent, and one that you can hold accountable. You know, it's very frustrating as a constituent when I have tried in the past, either on a provincial or federal level, to try and get in touch with my MP or MPP. And, you know, my experience has been that nobody really ever wants to talk to the people who voted them into office, or support people who have questions or concerns. That truly, at that point, if you're contacting those offices, you are they are usually the last resort to navigate answers. And so that, to me, was an important issue. And having that conversation with people, and, you know, not being treated, when you do get an answer, that you need to be treated like a person and you need to be heard. Sometimes the responses on either level, when I've asked a question, it's scripted. There's no personal one-on-one. I hear your story. It's frustrating because I'm not a number. I am a person, and I expect to be treated the way I treat people. And when I listen, I give you my full attention, and I'm not taking cookie cutter responses and pasting them into your question, because at the end of the day, the initial question was never addressed. So there comes the accountability and transparency piece.
So you want more from you want the local MPP to function as, I guess the ideal is, more of a community liaison at minimum, right? That's why the MPPs have ridings. The idea is it's a manageable number of people for one human to try to deal with, right?
And I mean, there are people who may never ever contact their MP's office, but there are several people, whether they're new to the country or whether they're aging population, who actually do need assistance navigating provincial services and sometimes even forms. You know, especially if you're not really computer savvy, just navigating the sites and where to go, or maybe they don't have access to high-speed internet or things like that. Just being able to help them on a sort of basic level, even just be able to help them connect with the resources that they need. I think that's our role, and I think it's also we are responsible for, you know, communicating with them openly and honestly, and I think that has been really been missing in the last several years with any government that's been in office.
My wife sent a couple emails to various levels of government with questions on how some border issues worked. We have 4 kids; they're all different ages, and some of the information it's difficult to decipher what it does mean. Like when you read through, you're like, I don't know what this means, and so she did write a letter that says, listen, you're the minister who's sitting on this, right? The information that's on the website under your ministerial purview is not doesn't explain what the rules are. And she got back a standard form letter and was quite upset about it because what you're saying does happen. You sort of write this letter, hey, I have a real problem. You detail it out. I've done A, I've done B, I've done C. I can't figure it out. You're the minister sitting on this file. Could you do something? And you get like a letter back that makes it clear they didn't even read your initial email, really.
Which it's frustrating because like there shouldn't be any other agenda that any member of parliament or the legislature has other than serving the constituents and helping them. I mean, it is a very high population, and we serve all people, not just the people who elected us in the community. And I think it's an important service, to be able to offer that for people.
Fair enough. So I looked at the platform on your website, and the number one was fight to end all COVID-19 mandates.
Yes.
So that seems to be a discrepancy between the current province that has some things even today still inactive. There's long-term care masks. I believe there's hospital masks. There's still sort of restrictions here and there. So why are those? Why is it time for those policies to go?
So my background, like I said, is nursing, and this is something that I think I was earlier asked. What if I had to grade the province's response to the COVID-19 pandemic? What grade would I give that? And I gave it a grade of an opportunity for improvement, because I think that all Ontarians can appreciate that 2 weeks to flatten the curve and stay at home, there was significant buy-in and people were willing to do their part. So that being said, where we struggled along the way is, one, the lack of transparency from the government regarding cases, what factors contributed to numbers and cases, the discrepancy of how the lockdowns were applied. So small businesses were locked down, especially personal care services like nail salons, hairdressers, barbershops. But yet we saw that the big stores, the big box stores, were allowed to remain open and truly monopolize the market and thrive during a pandemic. When I've met with people in Burlington who are suffering, and some people small businesses have had to close their doors. Others are hoping to make it through the summer. And we've been now, I think, restriction free for almost just over 2 months, or coming up 2 months. So it's all of those factors, but also to be able to hold the government accountable for the lack of transparency. Often, like, my question would be to them, why, knowing that you have reporting COVID numbers on a daily basis, knowing that you're testing everyone going into a healthcare facility, if you have 1,000 people entering, and at that time they were testing everyone going in, why is it that you didn't differentiate between how many people were coming in sick with with COVID symptoms and how many people were coming in for reasons other than that. Like, we'd have people coming in to deliver their babies, and maybe they tested positive for COVID. Those are included in the numbers that were being reported to the public. But those people were not there because they were sick. Those people were there to have a baby. And also, even the deaths. There are people who would come in with an unrelated, not COVID symptoms, an emergency. They would come in, say, for a motor vehicle accident. They'd swab them, and if the motor vehicle accident was serious enough and the person passed away, they were counted as a COVID death. And that's, to me, misleading information, at least to the public, because it's just reinforcing the fear that people were having. And their fear, just like pain, if you are afraid of something, your fear is real to you, and that's yours. But I don't think that we should be perpetuating fear and making it unnecessarily worse than it's actually based on.
I would say the public health response. I don't know if a bunch of people got into a room and decided this or it just happened organically, but there was a deliberate attempt to install fear. Like there was ads where like the machine slowly goes down, and there was a deliberate casting of this idea, well, you might be okay, but if you go out and you get it, you kill grandma. Is it worth seeing your friends if grandma dies? There was like this there was radio ads, and the radio ad was to install a fearful reaction in people, not, hey, here's the three hygienic things, or here's the three things we'd like you to do, or here's sort of reasonable. It wasn't to create a reasonable response in people. It was to create as much reaction as you could get through fear. I would say that that was the attempt.
I agree. It was a fear-based response. And the New Blue Party, and myself included, we are not anti-vaxxers. That message is being portrayed, but that is not the case. There are many, many of us who are vaccinated, myself included. And the issue is that regardless of your personal choice, you should not be discriminated against, whether you're wanting to enter a restaurant, whether you're wanting to enter a gym, whether you are wanting to maintain a livelihood and be able to earn a living. Like, those things should not happen. That is where I would say that there was an overreach, and it continues. That's why the party's platform, one of the top priorities, is to end that discrimination, because we know that as time has gone on, that the vaccines probably offer somewhat protection for individuals. But everyone's response to COVID, everyone's response to the vaccine, everyone's response to illness in general is unique. And it has a lot to do with many factors. The guise of public health, I have some concerns about that, because public health, when you look at the two words together, you would assume that it's about building health and maintaining health across the lifespan, whether you're 1 day old or 99 years old. Public health has a role to assist you in maintaining an optimal health for your personal self and for your age. And I think that there's a big disconnect there. And the reason I say that is because, say, for example, a public health department mandates a certain vaccine. So they mandate a vaccine, and you are told that this is part of the mandatory vaccines to be enrolled in schools. So, number one, you have to look at what the indication for the vaccine is. So, say I'm just pulling out one for meningitis. In the pre-adolescent high school age group. So one of the major ways that meningitis is a communicable disease is by sharing drinks, sharing utensils, kissing, things like that. So I'm not against the vaccination for sure, but my question is, that's a piece of maintaining health. But the other piece is education, and there's a role that I think that the government should be somewhat responsible for in promoting the education piece. So teaching kids who are of age to share drinks, share food, share utensils, or kiss, as they're getting into those age groups, giving them that information so that they can say, there's other ways as well to make sure that I avoid this, because no vaccination is 100% effective. Like, there is a possibility, like anything else, you could get sick. So when you pair those together, you have an opportunity for a better outcome.
I'm going to differentiate because I had one bugaboo with the whole vaccination, and that is the vaccination rolled out under an emergency use authorization. And part of the emergency use authorization, if you believe or don't believe in the vaccination, at this point stands. If it was 100% effective or 0% effective, this upcoming point, I think, matters. As part of that authorization, there has to be an informed consent piece, right? And it's the informed consent piece that jumps when there's a negative event, which is very rare, but there have been a couple very, very serious negative events. And you come back and they go, well, hold on, you made an informed decision to take this vaccine. It's not on us. You made the informed decision. We informed you of the cost, risk, benefit thing. You decided it was a benefit to you, right? And so therefore you got the, we're sorry you had a negative outcome, but you knew what this was going in. It strikes me that's completely incompatible under this stage of vaccine development with saying, oh, you have to be vaccinated to go to work, right? That's not an informed consent piece anymore. That's, you have to take this thing or you're fired. So it strikes me this is a much different state of vaccine development than the ones that have 40-year track records of, we're pretty sure after 40 years you're okay, right?
And I totally agree. When everybody adjusts existing policies to accommodate the mandate, and make no mistake, the government of Ontario and Dr. Kieran Moore did not mandate mandatory vaccine policies. Directive 6 clearly states that like public health hospitals, long-term care settings, they needed to establish a vaccine policy, but the policy gave different options. You could be fully vaccinated. If fully vaccinated wasn't an option, there needed to be a mandatory education for all. And there also needed to be the availability of rapid testing. So, he never said, oh, all these hospitals have to make mandatory two vaccine policy. This was their own doing. And then accordingly, the Ontario Human Rights Commission, they adjusted their policy. So it made it almost impossible for anyone to get a religious exemption or a medical exemption. The College of Physicians and Surgeons of Ontario told physicians they were not allowed to write exemptions. That's when you kind of question, why, if this is an emergency use vaccine, why do I not have a choice? And I think part of the sell and the buy-in from a lot of the public was that perception that if they did this good thing by being vaccinated and coming together and doing their part, that we would have been out of this a year ago. And again, it's not because people wanted to or didn't question the reason behind they were doing it, but they were so focused on having things return to normal. I think that's a big piece as well.
Well, we can confirm nothing returns you to normal because the as it turned out, the countries that are like level 10, the fantasy of public health lockdown measures, barricades on this, you know what I mean, as crazy as you can get, clearly are having a very, very tough time suppressing it. And almost everyone, like for a while, New Zealand was the picture of, hey, we're going to COVID zero, we lock down, and we live COVID free, we're all at the restaurants. And I kept saying, that's ridiculous. This is an island, very small, sparsely. We have 100,000 truckers going over the border every day, right? Stopping, eating, you know what I mean? So we cannot have a impermeable border to even try this, right? And so it was never to me a sane policy that we were gonna stamp it out. Now maybe the problem is that there was a group of people who said, "Oh, we're going to COVID zero. If we could just get to zero COVID and have some testing regime, we could be this island and it would go away completely, and you wouldn't have to worry about it." And there's other people saying, "I can't guarantee that that's not going to happen, but that's not going to happen based on any disease state that's ever existed on the planet Earth writ large." And then they would say, "Well, if we could just get this magical vaccine that's 100% effective, there's no polio." Right? There's very little polio, and it's like, again, maybe, but you're running on maybes. You're stacking up maybes and saying to people, well, maybe if we get this effective vaccine, and maybe if we have suppression, and maybe if we have border controls, we can get to this illusory COVID zero. Now you can forget about COVID and just go back to normal, right? And it strikes me that the people in charge at a senior level should have done a better job of saying, we cannot guarantee that will ever happen. That would be nice. Everyone would like it. But this policy is not about that. This policy is not about returning us to quote unquote normal. This policy is about mitigating disease spread so we don't have an embarrassing incident in the hospital. My wife works at a hospital. Don't think I'm not sensitive to that issue. But it's about minimizing the load on the hospital so we don't have untreated people and an embarrassment. That's the purpose of this, of 95% of the policy. It's not to make COVID go away. It's to reduce hospital load, right?
Right, but I would question whether that actually happened. And again, here comes another piece of years and years of no transparency and clear communication. Like you're selling that, what if your loved one doesn't have a bed in the hospital, to the general public, but those who work in a hospital know that every year during influenza season, potential of having no beds and hallway nursing is an actual fact. It happens pre-COVID. And again, they hide it. I I I just don't understand why they used to and continue to do those things. Like, you should be very clear, and it should be easy to find that information if you want to see it.
Listen, I know because my wife works at the hospital too. The ICU is overflowed with people, and there is people that should be in the ICU that they would like to have in the ICU, but there's no ICU bed, so they're in a level moving up to the ICU. That's every day,
Every day.
right? Is that your experience too?
Yes, for the last 20 years. We have, every organization, hospital across Ontario that I know of has daily meetings, sometimes depending on the time of year and the situation with beds. They have a daily meeting. They discuss how many admissions they're having, how many surgeries they're having, and they make decisions about going ahead with surgeries and moving forward with different things that they know. They tell you how many people are in emergency waiting for a medical bed.
And just for people listening, I'm sure Allison could correct me if I'm wrong, but there is a hierarchy of types of care. It's not like you're in a normal bed or click, you're in an ICU. There's different levels of criticality they've measured out to apportion the nursing staff and reviews appropriately for your level of being critical. It's not like you pop into an ICU bed or pop out, just like a striation, right?
Yes, right. And then they'll tell you, well, we have so many people to move out of ICU today, but sometimes there isn't a medical bed or a suitable bed available for that patient, because you wouldn't want to take somebody out of an ICU, uh, whether there was an ICU step down available or not, and put them in, say, an obstetrical or a pediatric unit, because the skills and the experience of those nurses, it's not an appropriate placement for that patient to receive the best care or the safest care. So it's not a one-stop fits all environment for sure.
Yeah, and is it additionally, just because we're on the topic now, is additionally your experience that also the hospitals are clogged up by people who should be moved to long-term care, but there's no spot, and so they're just hanging around in the hospital?
Yes, it's I mean, the I haven't I don't have the numbers recently, but I do know that there are several patients waiting for alternate level of care facilities. Sometimes, they have a bed available, but most often they don't have a bed. The other thing that tends to back up emergency departments and affect the amount and the volume in there is the mental health patients, people who come in and require an inpatient bed in a mental health unit. Those beds are very, very hard to come by. We definitely need to improve and expand those beds and the care that people receive for mental health services. It's a growing concern for Ontarians and hospitals alike.
The problem is you got massive population expansion, and everyone's trying to do, everyone's pretending that somehow they're going to get away with it on the cheap. We're certainly not increasing hospital beds by 1% a year, right? Like I can't even remember the last Oakville, but I mean, other than Oakville, which is just a change, right? How many new hospitals are getting, the ground broken on? I mean, not to be all doom and gloom, but the key in my impression of the Canadian medical system, and the only reason it's glued together and it's not chaos, is the quality and the compassion, and the people in it tend to be very motivated to provide care. It's like self-motivated.
It is. And whether you're a frontline nurse, whether you're a hospitality associate, deliver food, we are all there to try and provide a quality service to patients in hospital. And I think a lot of nurses, especially, regardless whether they're RNs or RPNs, are tired, as a lot of us are. It's Bill 124 that the Ford government put in a few years ago, only restricting our bargaining rights and options, and limiting nurses to a 1% wage increase. Um, I don't know too many nurses who would say it's ever about the money. Just to be clear, I've never, of course, I need to earn a living, but
But to pause you there, it's about the money. It can be about the money, okay? Like you are putting a lot of time and a lot of energy in these jobs, but lots of people are staying late, and to have 4%, 5%, 6%, 7% inflation and get a percent is a 5% wage cut. Okay, it's just
yes,
done through the back door. So I don't think that you can. I think you can be 100% dedicated, 100% whatever, and say at the same time I put a lot of money, time, and effort into my nursing career. You can at least not give me a pay cut as a thank you.
Yeah, I'd agree to that. But I still think that at the end of the day, the situation over the last 10 years in nursing, even, the administration is so top heavy. There's definitely nursing shortages in every place you go, but nurses are leaving in droves because we are feeling unappreciated, not valued, disrespected. And I think acknowledging that our time and our efforts, the time we spend away from our families, coming home exhausted, being compensated for that, yes, it definitely helps. But it's nurses have been denied vacation, forced to work overtime. These are very difficult times for the frontline people, and I think that Bill 124 needs to be repealed, and nurses need to be valued.
I mean, just the aspect of working in the hospital where where a significant number of people are having the worst day of their life. Like, this is it. This is the worst day of their life. And there's a lot of emotional baggage that goes with that. I mean, there's people dying, passing away. There's the family. I would not be a good fit I would find the emotion of it very hard to swallow day in and day out. So I'm not I'm not on the I wouldn't ever shrink from saying no, hold on, we can at least keep pace with inflation. If you think it's such an easy job, you come try it. Um, and I wouldn't shrink from it. I'd say no, we are worth every money. We're worth every cent we're paid, and don't create this dichotomy where it's like, well, if you really cared, you'd be willing to work for $5. That's ridiculous. That's no one. That's no one. And it's not a reasonable request for you, for the patients, for anyone. It's just completely unreasonable to try and equate, oh, you're trying to, your union is trying to hustle a couple bucks out of the taxpayer because you're living such lives of, luxury. Um, I've never been in the hospital once and thought, wow, that, the nurses are the nurses are not doing, like, the thing is, the nurses are really doing most of the actual heavy lifting. Not that the porters and everyone else is not there, but every floor, what's the most number of people on the floor? It's always the nurses. There's allied health, there's lots of stuff going around. I'm not saying occupational therapy and respiratory, like, there's tons of people in the modern hospital, but there's always more nurses than everyone else, right? Because the nurse is affecting all the medications. The nurse is involved in almost every procedure. The nurses are there, so the hospital really doesn't run without nurses, is the same. So just so we can hit a couple points here, it says renew political accountability by scrapping 100 million taxpayer subsidy for political parties, banning lobbyists from political parties, and cracking down on voter fraud of internal party elections.
So my understanding on this point of the platform is basically just around the fact that I believe that Doug Ford had said that he was going to eliminate the inter-party, like taking taxpayers' money and funding other political parties. So my understanding is that currently that did not happen, and over $100 million of taxpayers' money has been distributed as funding to both the NDPs, Liberals, and the PCs. I don't know if the Green Party received any of that funding, but that needs to stop.
Someone has to fund uh, uh, political activity, like ads. You guys need an office. Like, if you're running a professional campaign, there's a whole, like, there is a cost to attempting to get elected, right? So it strikes me you either have two things. It's either going to be paid for by donations, in which case people with the most money are going to, have a disproportionate impact, or you get the state to pay for it. I'm not sure I'm in love with either model, but someone's got to pay for it. Now, is the complaint here that it's uh, politically funded at all, or is the complaint that they sort of create this line where the three big, parties get funding? Instead of, you could say, hey, I'll tell you what, we'll pay you, 50 cents for every vote you get, right? So you can have some money to go forward. Is it the complaint that there's political funding at all, or is it a complaint about the way they're doing it? Is my question.
I think that again, it ties into the transparency, because most people either don't know, or maybe they aren't interested in knowing that where else could that $100 million of taxpayers' money, could we not find somewhere better? Now, for us being a new party, as well as probably any independent party or candidate running in the election, um, us as parties, we're grassroots as you get. Like, we don't get money from anywhere other than doing fundraising, making phone calls, pounding the pavement, so in fairness, if it's about equality as well, right? Like, um, if you're going to do it for free, then you know, it should be the same across the board, no special treatment. If you're the NDP, because it gives you a significant advantage when it comes to campaigning, that they have like a lot of money to put into promoting themselves, and having all the things that sometimes we wish we'd had, but we're making significant progress forward, getting the name out just on a grassroots. And I think it's the inequity as of it as well. Like, we should not, as taxpayers, we should not be funding, in my opinion, should not be funding political parties.
There's another, because the problem is always in this selection mechanism. They always pick this selection mechanism where it's like, okay, we're completely open on who does the debates, but you have to have 2 seats and 5 seats or something. And it's always like that is the fair line is always just sort of trimmed so that the parties we know are in the line, and then it's as hard as possible to actually grassroots something. I believe that the Chamber of Commerce in Burlington scheduled the debate, and I just want to confirm, like, you were discluded from that debate, or how did that transpire?
I was discluded.
I made up a new word, discluded.
Yes, discluded. Um, we found out about the chamber's question and answer period, and we addressed them and said, I'm not sure if you're aware, but we also have a candidate, myself, and they didn't get back to us right away. It took a while. Yeah, so then when we finally got a response, my riding president spoke with the gentleman, and we were told that you needed to have, I think they wanted at least one elected MPP, and polling at something. So I can't remember the percentage. So she said, well, we do have a member elected to Parliament. And the response was, no, it's not elected. She wasn't elected. She crossed the floor, and she was not elected as a New Blue Party member. So it's very interesting, because the Ontario Chamber of Commerce rules, which is where we were told this information and this was based from, that is not the case, and other chambers across the province have included New Blue members. So again, it's a little bit disheartening, because again, there comes the integrity piece. I think as a leader, you should be able to say to your board, this is not acting fairly or justly to all people involved. I'm going to do what's right and include all parties. But that didn't happen. I did attend, and it was interesting. But the conservative candidate was not present either.
There's a repeating theme. When I do the podcast, I invite all the people, right? And there is some response. I mean, I don't like this whole platforming thing because people are adults, right? So even if I get someone on the podcast who I'm like, this person is whatever you say, I'll like 9 times out of 10 just say what the argument is against what you're saying, even if I happen to agree with you. But the it does, you do sort of for a second go, I don't think I want to like, where's your responsibility for building people up? But I think you don't have an MPP voted as vote as new blue. The problem with that logic is if you are on one side and you cross the aisle, right? You can vote in that group, and your vote is honored as part of that group, right? They don't say, oh no, you weren't elected as a progressive conservative. Like, the parties are an establishment of the MPs that we elect, right? And then they form parties. But I don't think that if right now, uh, a majority or super majority of the legislature declared themselves as Party B, right? Oh, you know what? We're going to make a new group, Party B, right? And said, we're just going to pass laws as Party B. There's the party superstructure is kind of an imaginary overlay on the elected members of parliament. So I think if you are elected as a member of parliament, uh, I think the rules have to be, because you were elected by people, the litmus test of your sanity and your respectability has now been passed. Like, because people voted for it, we're going to have to say the litmus test has been passed. To, are you a complete nut? Are you completely crazy? Or your ideas are so beyond the pale they shouldn't ever be aired? Hold on, you're elected as a MPP or an MP, and even if you're now way outside the prevailing narrative, right? I do think that we have to say, hold on, the litmus test of your credibility, of your reasonability or credibility, and if people want to hear from you, if they think your ideas are nuts, that's been passed now. And so it seems to me, when the body says, well, here's the people at the debate and here's not the people at the debate, what they're doing is they're saying, no, we're going to override the judgment of people and insert our own idea. Now, if there was a person in the municipal election or the mayoral candidate that seemed to come out of nowhere, that, like, you know what I'm saying, maybe, right? But I think you should definitely err on the side of caution of letting people, in that have any kind of support, because otherwise it's three parties just saying the same thing for an hour and a half, right? Not saying the same thing. That's not fair, but they don't have to. A whole bunch of ideas don't even have to come into the conversation because they've all decided it's politically expedient to agree with them, right? Like, the structure, I think, if we made, I think the structure is problematic. But why do I say the structure is problematic? Because you have health units that are supposed to be local experts in all these places. So if there's like a cholera outbreak, the local health unit can educate people of cholera, do what needs to be done in the local hypothetical cholera outbreak area, right? But that doesn't affect the rest of the province. So now the health units make sense. The problem is the health units have this autonomy. So what we saw a couple times is the province would say, okay, well, we're coming up with this reduction in measures, right? Then the health units could all pop off and say, well, we care about people. That, you know what I mean? We actually care about other humans. So we're going to have this higher standard of safety, right? And we're just going to impose it themselves. And then the question to the now centralized health service, the reporter's question is, why do you don't give a damn about people, whereas they do give a damn about people in X and Y and Z, right? So it became impossible as this went on, in my mind, structurally, for them to really control these health units, right? Because it was just so tempting for the health units, who are people who are obsessed with public health and have careers in public health, to come up with this safetyism, you know what I mean, and say, we're going the extra mile. That became the concept. We're going the extra mile. If one mask doesn't work, two. If two doesn't work, three. If three doesn't work, stay home. If staying home doesn't work, and it was so easy for the health units to say our responsibility is health. We don't worry about the economy. We don't worry about macroeconomic issues. We don't worry about education. We don't. This is none of our plate has anything to do with this. Our plate has to do with top line public health measure. People, are people dying, and is the disease spreading? And we can optimize everything for that, and we can put things in that may or may not work, but might help our theory. Can't hurt us. That's the point. If it doesn't hurt us, go, right? And so just became too easy for the public health units to pick the most restrictive things. And if the province wanted it dialed back, they could grandstand against the province, right? And the province didn't have this mode where they could go, okay, we're dissolving all the public health units because number one, these public health units are required for all of the rest of the things that are going on in public health, and they're deploying half the vaccines, and they're managing they're managing all these things. So they can't just write a law that says goodbye public health unit because we're still depending on these units for public health, right? But that's maybe my analysis. You can tell me if you think that's right or I'm crazy.
No, I agree. Again, though, it comes in that piece too about public health. Like, wear a mask, fine. But did you ever tell somebody how to wear a mask? And if it's a single-use mask, it's a single-use mask. You can't be touching it, pulling it down. Like, it defeats the whole purpose.
I've seen a couple times because one time my wife came in. This is pre-COVID. She was delivering a baby and she had the sniffles for a check. And the droplet, if you ever want to see garbage being produced, come to the hospital and watch the droplet prevention thing. And I'm like, of course it works. The person gets up, they gown up, they have a big smock, they have a mask, they have a hat, they have gloves, they go in, they interact with the patient, they come out and they throw it all in a bag of garbage.
Yes.
Is this what we're talking about? No. What we're talking about is somebody takes a mask, it's been hanging in there from the from their car for 2 weeks now. You can see how dirty they are, right? And is touching their face and et cetera, et cetera. And so there was tremendous emphasis on the mask issue, but no emphasis on on even if you wanted to imagine that the mask was capturing a massive percentage of expelled COVID particles, right? You still have this bomb of trapped COVID particles the second you take it off your face, right? Just logically.
Yeah.
And if you thought that they were trapped in the mask, well, you wouldn't want to touch the back of that mask. That would be coating your hands with these particles. Just logically, it doesn't make any sense because the one thing that put me in the spin cycle is they had the masks for the kids, but they all had cloth masks. And then they put the mask when they're eating. Okay, where's the mask go? Because they're all eating lunch. Oh, what we'll do is we'll produce a like a little fanny pack pouch, and we'll put the mask in the fanny pack pouch, and it just lives in there, rolls around 360. And I'm like, well, when you take it out now, just think about this logically. The particles on the back of the mask have to now be on the front, don't they? Because I'm doing this all day.
Yep.
And so I'm just like, logic. We just like, you don't have to get into um, fantastic theories. It doesn't make sense. I mean, you don't have to get into fantastic theories if being in a Walmart with 300 people spaced out, okay, does not represent a significant disease risk to humans, then being outdoors in a patio in a 20-person restaurant cannot be worse.
No.
Unless everything people have learned about diseases for the last 100 years is wrong.
Agreed.
And so I think these things were just logically at loggerheads with each other. And the message never came, we're doing our best, guys. We don't know. We're doing our best. We're clutching at straws. Okay. It never came, these rules are capricious. They are ridiculous. But again, we're doing our best. We can't straighten them out. It was always, we are super slick, super sophisticated. We have modeling. This thing drove me crazy now. You're talking about, we have modeling. Great. By who? Who did this model? Can I see this model? I'm a computer scientist. I want to see the model. Nope. You can't figure out who created the model. You don't know where the model came from. You don't know the construction of the model, what things go into the model. And I'm like, okay, listen, if you're going to base policy for everyone in Ontario on modeling, I want to see the source code for the model things. And you got nowhere with that. They wouldn't even tell you who was doing the modeling. You know, and so this modeling kept coming out with these completely scary, projections, and I'd be like, okay, that's possible. I can't see the model. And so it was impossible to argue anything down because people would say, oh, look, if you just, and there was this concept of let it rip. No one was letting it rip. I don't know any credible person that in the time of COVID said the correct response is kissing parties and try and get this over. I don't know anyone who was selling that.
No.
But it became this concept where if you don't buy into these restrictions, if you don't buy into these modelings, if you don't buy into these things, you're quote unquote trying to spread COVID as fast as possible, throw everyone to the wolves, and kill as many people as possible. So the minute you came up with a, hey, do the kids really need to wear masks outside? This is one of my bugaboos. Where'd you get this from? Where'd you get it from? You couldn't find it where it got. It didn't come from anywhere. It came from someone walking out and saying, we have this new policy. The worst thing for public health is questioning public health was kind of the mantra. And I think public health has really unfortunately discredited themselves, and they seem to be unable to back out. They seem to be unable to give up, and they seem to be unable to go, listen, guys, we did what we could on this file. As it turns out, we don't have a technological solution to everything in the world. We don't have a technocratic solution, and you can make people do whatever you want, but the kinetics of the disease and our current society are incompatible with suppression. Sorry.
Yeah.
Even when they were backing out, I understood what they were saying. Like I understood this subtle transition when they moved from the last lockdown. They did start saying, "Hey, this lockdown is not going to make COVID go away. This is our last kick at saving the hospitals," right? But never in a way people understood. Never loud enough and clear enough. Was there a change in policy? So I think public health has been hugely damaged, and I think that's the mistake because you need public health to, for example, calm people down about monkeypox. Just calm down. You're not going to get outbreaks of monkeypox. You have to touch the person. It's fluid on fluid transfer. You're okay. Like, but they need credibility.
And I guess they've lost a lot of the credibility. And what's frustrating for me is like, again, it goes back to transparency. What is wrong, and why are people so unwilling, one, to be able to say, I'm sorry, we may not have done everything 100% right? And why can't, when you tell somebody that, they say, okay, thank you for admitting that it hasn't been 100%, but what can we do to make this better for the next time? I personally think that at some point, hopefully sooner than later, there needs to be an inquiry to how this whole thing was handled by public health, the province, like Ministry of Health, Minister of Long-Term Care. They all need to be involved because it's absolutely disillusioning that everybody has lacked the transparency. And in order to make those informed decisions, you're right, Greg, like people need the information, and there are a lot of well-educated people out there who can like review documents and data and make an informed decision. But if you're not giving it to them and you just expect people to blindly trust, that's where we, start saying, wait a minute, something here just doesn't make sense.
Yeah, well, there's some aspect where the mob outpolices the experts, like the technocratic experts. If you ever saw the whole thing with the Central High School, you got heavies that were crunching the data, and then the province would come out, like the not the province, the school board would come out with these, you know, how many kids are going to each school, how much projections, and people at the meeting were destroying them. Who's like, I have a background in data analyst. Here's the 10 mistakes. You know what I mean? And so there, the point is this: if let's say you had this modeling released, and let's say 20 computer science experts got together and they said, we'll improve upon your model, thanks, and they came up with different modeling. Well, why is the fact that there's another group of 20 people that have a better model so threatening to you and your modeling, right? I mean, why can't you sit there and go, okay, my model can be improved, my program can be improved, or it can't be improved this way because your ideas are crap, right? There was this, there is some kind of, there is some kind of, uh, um, I don't know, what do you want to call it? Something in the atmosphere where that person is in a position where they don't feel that they feel that sort of a free speech attack on their ideas is threatening to them personally, right? I mean, and and they're reacting as if anybody who says anything different is some kind of challenge, and then they work themselves into ridiculous spaces of kids outdoors wearing masks outdoors. um and if you go, where did you, they say, okay, well, this is science supported. Well, fine, where is the science, right? If you want to go into a world of science, where is the science? And listen, I can't tell you uh, with 100% certainty that masking kids in public schools works or doesn't work, because there is no cluster randomized controlled trial that's ever been done to actually look into it. But of the 8 or so studies that I've read through and my wife has read through on it, they all come up with bupkis. There's no effect. And probably because if you just watch children for 10 seconds, you'll figure out what the problem is. The mask pissed them off, they touch it, they contort it on their face
Hmm.
so that the air comes in and out nicely. It's off. Like, you could just watch them be like, this is the opposite of the kind of discipline we need to install into a nurse who's going to walk into an infectious area. It's the complete opposite.
Yes.
My point is, there is no scientific evidence you can see it working that I've ever seen of the 8 or so studies. There's no positive signal. Could it work a little bit? Again, we don't know. There's no perfect, or really well done trial. But we certainly have a lot of evidence that shows if it has an effect, it's so little it's unimaginable. So it either doesn't work or it's so ineffective you can't show me it works, right? Either one of the two. But if you go and you say that to people, their reaction is, no, you're an idiot. It's just very obvious. If you cover your face, the stuff stopped behind the mask. And it's like, it's not that obvious because the COVID particle is like 10 microns. It's big. Okay. And the holes in the mask are like 200, 300. And yes, an N95 mask can screen out 95% of those particles. Try wearing one of those suckers all day.
Yeah, it's impossible.
It's not comfortable because you have to generate the suction power to suck the air through this extremely fine filter to get these particles out. And what you do is you concoct some way to put this on your face so that it doesn't do that. And this is why, I'm sure you know, the hospital might, when you go for an N95 mask, they don't just hand you an N95 mask. You go for a fitting. There's a whole production around finding one that works for you, and they do testing, and they can demonstrate that it's sealed up, so you can confidently walk into the room of an infectious person for 10 minutes and do your bit and get the hell out of there, right? But that's not kids at school for 6 hours, 7 hours, 8 hours a day.
And I mean, at the end of the day, even if, if the mask contributes to you feeling safer out and about, then again, it goes back to our new blueprint. Like, that is your choice. You're welcome to do that. Nobody's stopping you from doing it. But this society we've created, built on fear, and somebody else's right to feel that they can tell you, oh, where's your mask, and all these things. Like, no, that's a personal choice, and you you should be able to, if you feel safe going into a grocery store and not wearing a mask, then you should be able to go in. The risk is yours. You've looked at the risk and benefit. You understand, hopefully, what those are. And then if you choose to not do that, wear a mask, then it's on you. You'll do what you need to do to protect yourself.
Yeah, I agree. Now, the one little caveat that I don't like about that is my original objection to some of the mask stuff was that if you turn the mask into a lucky rabbit's foot, right? The problem is people make decisions betting on that rabbit's foot.
Right.
So I was talking to someone, and they were going to an old age home, and the other one of the other family members wanted to go share a ride with them, and they were driving a car for an hour and a half, confined air environment, and the person literally said, "Oh no, don't worry, we wore masks." And I'm like, an hour and a half in a car? Uh, why did you think that was going to work? What piece of information received to your brain that oh, it's fine, I don't have a mask, right? I have my mask on. And the problem is it produces errors in what people do.
Right.
Instead of people thinking to themselves, and you can, to me, you expose this very easily by you say, oh, the masks are effective, great, put a percentage on it. What percentage of contact, COVID person, a person who doesn't have COVID, there's an infection transference. Oh, I put them both in masks and they both do exactly what they were doing before. How many cases am I preventing? Am I preventing 50, 20, 80, 5%? And if you just ask people that, they have no answer whatsoever. They say, maybe some is their answer. Maybe some. Okay, well, that's fine. But that's not the message you're giving. You still have messaging to this day. Oh, if you want to be responsible and look after your health, wear a mask. Okay, in what setting? I mean, it's ridiculous. You know what I mean? Where does mask come from? How old is it? There's 100 questions, right, around this like mask issue. But the general notion is you're somewhat safer, quote unquote, safer if you are wearing a mask. And I'm like, if you keep telling people that 2 years in, you have to demonstrate that's true. Demonstrate it for me.
Yep.
Data, something. Because if you don't have, scientific data, if you don't have multiple studies that confirm this is true, and very few studies that show it's not true, and you don't have those things, what you've now sort of become is a witch doctor. You're scaring people based on a notion of, hey, you guys got to, get the magical flower and rub it all over you. And but you don't know that that's true. You don't have a demonstration. And what modern science kind of teaches us is most of the things you think are true or are intuitively true are 100% wrong. That's what modern science teaches you, that when you get into this, telling me nursing, how many things in nursing do you do that's like sort of would be surprising, to a layperson? They're like, no, this does work, this doesn't work. And you're like, okay, going from there. Okay, so you got last two points that I was interested in. You have reform education by reducing administrative costs, alternative school tax credits, stopping woke activism, and renewing critical race and gender identity theory from our schools.
Oh, yeah. So my son actually had to defend this in a barber shop the other day. So, first of all, I think it's important. It's a little misleading, the critical race theory piece.
You got to start by talking, just because I've done this a bunch of times with people, right? What is meant in your mind by critical race theory? Because people have the definition is all over the place, right?
So to me, and in the context that it's, I believe it to be directed towards in this piece of the platform is specifically related to the Ontario Bill 67. So Ontario Bill 67 was introduced, first had a reading, I believe it was January of 2021, in the legislature. And again, Belinda reviewed the piece of legislation that was being presented, and she took a step back and she was like, I'm not even sure what I'm reading right now. So she went home, she read it again, and she read it with Jim Carhalios, her husband, and she said, "Is it what I think this is meaning?" And he said, "Yes, that's exactly what it means." So so after reading it, she voted against the bill being passed.
This is in one of the preliminary readings, right? It's not actually passed yet.
Oh no, they put the PCs and NDPs pulled their support from the bill.
Okay.
I think in April. So the reason being because this bill specifically was talking about education, the education system, and implementing a plan to address subconscious racism in the schools. So I think that that's a slippery slope. Um, that being said, and the reason for that is because basically it gives a person in a position of power to look at a child and say that you are being subconsciously racist against another student, um, which is worrisome.
So the bill we're talking about, right? The elements is that it would put loosely defined critical race theory education in the school system, right? It would set up a tribunal to indicate if a teacher uh, was being negative against critical race theory. There could be disciplinary action. This is the one we're talking about, right?
Yeah, but not just the teacher. It involves
It's the formalization of a theory where the interaction of people in the school environment is going to be seen through the quote unquote critical race theory lens, right? And therefore, you can say, for as an example, if you were to claim uh, that this was not a racist incident, that the race of the person wasn't entering your mind, you know what I mean? You're just having a fist fight with some other kid that just happened to be of a different race. The theory could go, you simply claiming that this was not a race incident itself runs afoul of some of the critical racist doctrine, and therefore now you're in this quagmire of legal um, um, process. A person backing you up could get dragged in. It was putting this system in the schools as a permanent apparatus. New hires would have to conform with this, and it was the way I put it is the not anti-racism treatment, the non-racism schooling. Just to give the two concepts new words that we have is the Martin Luther King theory of non-racism, where you judge everyone by you do your best to judge everyone by their independent character, and that's as far as it goes. Whereas the anti-racism theory bounces out into the fact that that's insufficient because there's structural problems that are re-embedding uh, racism. So the Martin Luther King theory is itself problematic, right? And because it limits people. So the anti-racism theory is an expansion from, tell me if you think I'm explaining this incorrectly, is an expansion from the Martin Luther King principle of just treat everyone equal on their own devices into, hey, that's not good enough for a variety of reasons. And and a huge expansion of what we think of the traditional definition of racism growing up, my age, to expand anything that might have a disparate impact on anyone, intentional or not, conscious or not. So that was the attempt to install that in the school system. Do I have that correct or?
I think that that's my understanding as well. I think that the concern is that they were going to be teaching this beginning at a very young age, and although I think that it is applicable to some age groups to learn about it, to have give school boards and officials the ability to literally charge somebody or like criminally, I believe it is. I have to read it's been a few months since I reviewed the bill. I don't think that can have a lot of impact, long lasting impact on children, especially if that wasn't actually the intention. I have concerns about that, but regardless, this, I believe, was formatted, the new blueprint, before the bill was pulled. It didn't pass second reading, and the NDPs and the
Well, a lot of that's coming in anyway. Don't kid yourself. I mean,
oh yeah,
outside of the formal tribunal, there's lots of people um, who are of the mind that there is a continuum of acceptance and a continuum of accepting people and not discriminating against them. And from sort of the suffragettes on, it's an opening window, right? And so this, to people, the anti-racism theory is an expansion of is of a linear expansion of acceptance, right? So if you're teaching kids to be more sensitive, what's the problem? Would be their point.
yeah. No, there's not a problem in teaching people the other, to be more sensitive and just actually aware of what you feel and how you interact with others. I don't see a concern with that. The I think there's a bit of a misconception as far as the general public who may not have um, a better understanding of critical race theory in itself, is that they hear the words critical race and they think that what's happening, or what the intentions of us not supporting the critical race theory in schools, is that we don't want to teach, we're against having history being taught, whether it's the like any history. So it's not about removing history and not teaching about people's experiences, because that's a huge important part. And in my opinion, that helps support people how they relate to others. When you can have compassion for someone else's experience as a race and what they've experienced growing through history, and all the things that they've endured and had to go through. I think that you have to have that in order to foster compassion and understanding and appreciation for other people. So that one, I I do think that it's important that people understand that we're not against, teaching about the transatlantic slave trade, or we're not against teaching about the atrocities that the church and the government had their roles in the residential schools with Indigenous families across the country. That's not what the intention of this is. I just wanted to make sure that people know we're not trying to erase history.
Like that's all fine. I agree, all that's fine too. What's the element, what I know this is kind of a hard question, but what is the element that trips it over into this part of under the umbrella of critical race theory, is the problematic element that I don't want somebody walking and telling a 3-year-old?
I think that if we teach kids, so a 3 or 5-year-old, that you're white and you're an oppressor, and we have the same child in a classroom who is, say, South Asian or a person of color, you say you're oppressed. I worry about the impact as a to a child at an early age, attaching that label, because obviously racism exists everywhere. And the concern is that a 3 or 5-year-old may not be racist, but if they're told that they are inferior because of race, and it may not be explained properly. I'm not a child psychologist or an educator, but could that not necessarily have an impact on how that child grows through life instead of just instinctively seeing themselves as equal? They may see themselves as different in their physical appearance, but not necessarily, like, I worry about planting the seed that they are oppressed just because they're a person of color.
The problematic element, I would say, is that when you come and you say to the kids, okay, well, hold on. Hey, kids, there is a whole bunch of strata that we could use to cut them up, right? We could say, well, we're going to put the tall kids in one camp and the short kids in another camp. We could put the rich kids in one camp, the poor kids in another camp. We could put people that are athletically gifted. We could just have them run across a field and divide them into two kids that are more athletically gifted and less athletically gifted. We could then say this matters a lot. We could say, you kids who are athletically gifted, you are destined to maybe play athletics and all these things. Oh, you kids that are not athletically gifted, nah, this is not a case for you. And the problem is that I think that the people believe that you can just walk out there and say, oh, there's this big difference in, let's just say, athletic ability between the two groups of kids, and say their idea is how the kids will respond is, oh, if I am athletically gifted, I have to be more sensitive to these kids that are not athletically gifted. I have to be more sensitive about, they might be feeling they wanted to be on the relay team or they wanted to be on the track team and they can't, right? And but just spilling this out will be a net positive. And I, in the same vein, have the concern that you've chosen the primary groups for them, right? And now that you've chosen the primary groups and said, oh no, you're not all the same. You're in this one racial group. You're in this other racial group. Oh, by the way, you guys should fight. Um, uh, I'm not entirely sure that message, even if true, let's just, to give the devil's due, say that's true. I don't know what a 3-year-old does with that. They can't vote. They don't have money. They don't have a job. They don't affect anything. So it strikes me that you're loading them with a kind of original sin they can't discharge.
Right.
Right. And even if they say, yeah, even if they say, no, this is my friend, you go, well, hold on. Are you sure that subconsciously you're not just slowly trying to undercut them, slowly trying to chip away at them? Years and years and years down the road, we see this big imbalance. The source must have been you. Right. I'm not sure that's the world's greatest idea, but there's lots of people who are sure that the only way to get into statistical racial equality across all domains, doctors, boards of CEO, people running for politics, that the only way to get there is to arm every single human with the idea that if the outcomes are unfair, it must be the society that's doing it. It must be that the society is slowly chipping away at all these people who did want to be doctors. You know what I mean? And we must be undercutting them. If the girls aren't doing as well in math as the boys, it must be because there was subtle hints just chipping away at their confidence in math. Maybe didn't help them, right? And that's why you get these disparities. There must be there's some kind of cultural ethos that's in the air that we're all responding to, and the only way to combat that is if you put in people's heads, my judgment is bad. I think I'm helping kids, but maybe I'm just maybe I am intentionally slighting the girl in math class, and I should actively think about resisting, you know actively think about it. They think that that's the only way to make everyone paranoid that they are doing it. if you want me to spin the positive vision of what the anti-racists think they're doing, is they think the only way to reach equality is if everyone's actively managing these interactions 24 hours a day, with fear that they'll go to a formal review if something doesn't work out. And that's the only way you're going to get X number of doctors, X number of lawyers, X number of engineers to be similar. And if your theory is, well, hold on a second, just as an example, if it turned out that most forest rangers, if there was a disproportionate number of forest rangers that happened to be Indigenous, I would kind of go, well, that seems fairly reasonable to me, wouldn't it? I mean, they would be in the areas where these jobs are. You know what I mean? There'd be 100 reasons why that's true. Culture, there'd be cultural emphasis on taking care of the land. They would be out in the places where these jobs were. There could be 50 reasons, why you would think that, right? And they think that when you say something like that and flip it around, you're making terrible excuses for a system which benefits you and hurts these other people.
Yeah.
And so that's what they think has to be overcome. The notion that you say, well, hold on, I do think the world's basically fair. I don't think that people are actively screwing over the kid in grade 1. I mean, I've seen no sign that the teachers are actively attempting to screw over certain kids of certain races, because some of the teachers are of all different ethnic groups anyway. That would be more weird, but could be, arguably they are. So I don't, and they think, well, hold on, we have to overcome your idea, Greg. The fact that you set that out there, that you feel comfortable saying it, that's the problem. And we have to get all these kids young and put in their heads the idea that that is the problem, that someone's defending the current apparatus and defending the justice of the current system, right? So that would be my positive spin for the anti-racism.
Most kids, I think, learn or sort of get the idea of like a prejudice or something racist. They often get it from home.
If you have the kids in a group, people are going to disagree with this. They're going to say this is the problem. But if their own personal interaction with a person of the other race is positive and they've been at the dinner table and they know these people, they know these family, I think it's very hard to convert that person to a racist because their personal experience is not that.
Right. Yeah. I'd agree with that.
But that's considered by this group the naive piece of idiocy. That even though that person does have personal experience or was in love or even married to a person of the group, they're still in the milieu of constructing this racial hierarchy that they believe exists, even to their own detriment in a way, right? Yeah, and so I'm not so sure I can't say that's true or I can't say it's not true, but I have said previously I have real some discomfort too on walking into a grade 3 classroom and laying this all on them. The high school students you can go nuts on. If you want to bring this out, 1 year before university, so all the anti-racist achievements, sure, I don't have any problem with that. We're not talking about shielding high school kids from any of these theories. I don't just see what a 3-year-old's supposed to do with it, other than sort of generally feel bad for the world in which they live, right?
Yeah, I agree. Like, and I think that is the piece too. That we're not saying that it has no place. We're saying that it needs to be looked at, and it needs to be age appropriate and at the right time and at the right place.
Okay, excellent. Are there any other parts of the platform that you would like to highlight that you think are important?
No, I think we've covered a good portion of it. We've talked a lot about healthcare, long-term care, even. The only other thing that we didn't touch on was the hope to reduce the HST and axe the Doug Ford carbon tax, which we're hoping would be able to save at least 25% of the cost of fuel.
Now, so you would reduce the HST from 13% to 10%.
Yes.
It says here, and then axe the carbon tax. So why should we do that other than what's the benefit to that? There's be less money in the government coffers.
Well, I think that when you look at the whole amount of spending, not include the COVID spending, but there's ways to generate money. Um, like, for example, the online gambling license, the $500 million online gambling license that the Ford PCs gifted to the Toronto Star.
What does that mean exactly? I don't quite understand that. Could you give me some details?
So um, the Toronto Star was, I think, hurting financially. Of course, they would have gotten some money from the federal government, I believe, but the Ford PCs, to help them stay above water, gifted them a $500 million online gambling license. So basically, if you were an organization and wanted to obtain the same license and apply to the province for that license, it would cost you $500 million to obtain the licensing. So what the Ford government did was gift that to the Toronto Star, which was a significant financial gift on the backs of Ontarians, which could have been used better elsewhere. It's my opinion that the establishment media, legacy medias, they should be self-sufficient. They shouldn't have. Not saying that we can't help in times of need, I guess, but why should it be always us helping? And you should be able to survive on your own. I believe there can also be a conflict of interest when the person receiving such large amounts of money, in order to be able to sustain themselves, potentially will lean towards the side of the hand that's gifting. So I don't think it's a win-win. I think that Ontarians deserve to have that money in their hands and in their programs that they utilize every day. Not everybody uses the online gambling, and they probably don't benefit from it in any way.
So what's next, Allison?
So getting back out on the road, doing some more door-to-door canvassing, trying to just get the word out about the party and myself, because that's half the battle. People haven't heard of the New Blue, and once they do know about us, they are interested in learning and reading and doing their own research and doing the best they can to have a fully informed choice for June 2nd.
Okay, well, thanks very much for being on the program, Allison.
Thanks for having me, Greg. Have a great weekend.
You too.